Azithromycin. Have you ever taken an antibiotic for a cold or a throat infection? Not all antibiotics work for every infection, but today we'll talk about one of the most commonly used antibiotics, azithromycin. What is it used for? How should you take it? And what side effects should you watch out for? Stick around to find out. What is azithromycin? Azithromycin is a broad-spectrum antibiotic from the macrolide class. It fights bacterial infections by stopping bacteria from growing. Doctors often prescribe it because it works quickly. It has a shorter course than many antibiotics. It has fewer side effects compared to other antibiotics like amoxicillin. It does not work for viral infections like the flu or common cold. What infections does azithromycin treat? Respiratory tract infections, like pneumonia, bronchitis, sinusitis, pharyngitis and tonsillitis. Skin and soft tissue infections, like cellulitis, impetigo, ear infections, like acute otitis media, middle ear infection. Sexually transmitted infections, like chlamydia, gonorrhea in Mycobacterium, avium complex infections. It is used as a preventive antibiotic for people with weak immune systems, like HIV patients. Eye infections, like bacterial conjunctivitis. Dosage, oral tablets, and suspension for most infections in adults. 500 milligrams once daily for 3 days, or 500 milligrams on day 1. Followed by 250 milligrams daily for the next 4 days. Children greater than 6 months old, 10 milligrams per kilogram per day for 3 days, or 10 milligrams per kilogram on day 1, followed by 5 milligrams per kilogram for the next 4 days. Strep throat and tonsillitis, children greater than 2 years, 12 milligrams per kilogram per day for 5 days. Sinusitis, adults, 500 milligrams daily for 3 days. Chlamydia and gonorrhea, 1 gram single dose. For gonorrhea, take with ceftriaxone. Prevention of MAC, 1.2 grams once a week. Intravenous dosage. For severe pneumonia or pelvic inflammatory disease, 500 milligrams IV once daily for at least 2 days. Then switch to oral tablets. Eye drops for bacterial conjunctivitis. 1 drop twice daily for 2 days, then once daily for the next 5 days. Avoid wearing contact lenses while using eye drops. Common side effects: nausea, vomiting, diarrhea, stomach pain, headache and dizziness, fatigue. Rare but serious side effects: allergic reactions, liver damage, heart issues, Clostridium difficile. Who should not take azithromycin? People allergic to macrolide antibiotics, severe liver or kidney disease, heart patients, QT prolongation, arrhythmia, pregnant or breastfeeding women. Drug interactions can increase heart risks if taken with amiodarone, quinidine, warfarin, may increase bleeding risk. Digoxin, cyclosporin may increase their levels in the blood. Always tell your doctor about any medications you're taking. Final advice: follow your doctor's prescription. Do not self-medicate. Complete the full course even if you feel better. Take with or without food, but if it causes stomach upset, take it after food. Do not use it for viral infections like the flu or common cold. Report any side effects immediately. If you found this video helpful, like, share and subscribe for more medical insights.